infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Well, hey everybody, this is Robert, and welcome to today's show. Now, earlier this week in Lakeland, Florida, I attended an educational program with an expert panel on Alzheimer's disease. This included information about research, risk prevention, and other topics. The event was hosted by the Florida Gulf Coast chapter of the Alzheimer's Association. And my guest on today's show is one of the expert panelists. Joining me now is Phil Sabel. Phil is the Clinical Research Coordinator at Axiom Clinical Research in Tampa, Florida. Hi, Phil, and welcome to the show.
Hey, Robert. Thanks for having me.
So, Phil, in addition to your work at Axiom, you do have a link to the Alzheimer's Association. What is that?
So we became involved with the Alzheimer's Association a few years ago. So every year, the Alzheimer's Association holds the Walk to End Alzheimer's, which is their big fundraising event. So we were a participant in that. We helped raise a number of funds, and we were approached after that about also participating as volunteers in various capacities. So now I serve on a couple of committees, one of them being the Discoveries Committee, and you attended one of their events recently. The goal of that is to get the community more aware of what's going on with clinical research and Alzheimer's disease in general. We also participate as Alzheimer's community educators, so a number of our staff members here also volunteer our time to go out into the community and present information for the Alzheimer's Association's Caregiver College, and that's essentially a 5 to 6 week program that covers things like the general diagnostics, treatment for Alzheimer's disease, things that caregivers need to be aware of as the disease progresses. It also covers things like medical legal decisions that have to be made over the course of the disease. So we participate in that capacity with them as well.
Okay. Let me go ahead and start out with, I guess, is the most basic question. What is Alzheimer's, and how is it related to dementia? Is it synonymous?
So that's kind of a tricky question. So the way we look at Alzheimer's disease has changed a lot. So in the past, Alzheimer's was something that was diagnosed from a clinical standpoint. So people would come into the office and they would report what we know to be the classic symptoms of Alzheimer's disease. And most of the time that was progressive memory impairment. So initially just kind of minor issues, remembering the names of things, the names of people, forgetting appointments, things like that. And as the disease progresses, these impairments become much worse and start to impact the person in their day-to-day life. Now that we've had some advances with technology, particularly with neuroimaging, Alzheimer's disease is something that's diagnosed usually via biomarkers. So we're talking about amyloid PET scans. So Alzheimer's is a disease that is characterized by the presence of amyloid plaques. So these are proteins that accumulate in the brain over time around the cells in the brain, and they form these really sticky clumps that disrupt cellular functioning, and they start to kill brain cells, and eventually we start to see the symptoms that are associated with Alzheimer's disease. So now we have the imaging techniques that allow us to view those things while the person is still alive and offer the opportunity to diagnose the disease much earlier than we ever have been. And when we're talking about dementia specifically, it's kind of a general clinical term that refers to a cluster of symptoms. So in order to be diagnosed with dementia, a person would have to have, say, for example, memory problems, and also addition to other symptoms as well. So, say, language issues, problems with mobility, issues with decision-making, problem-solving. And so these cluster of symptoms would have to be severe enough that the person would be unable to take care of themselves on a day-to-day basis without assistance. So that's what dementia is. And so when we refer to somebody as having Alzheimer's dementia, Alzheimer's is that underlying pathology, those accumulating plaques, and dementia is the impairment that we often see after the disease has progressed to the point where the person is quite incapacitated.
Now, how common is Alzheimer's in the United States?
So right now, the rate of Alzheimer's disease is estimated to be about 5.8 million people in the United States. And without any type of cure or way to slow the disease progression down, we're looking at about 14 million cases of Alzheimer's disease just in the U.S. by the year 2050.
And we're both based out of Florida. How does Florida fare with Alzheimer's disease?
So we have a really disproportionate number of Alzheimer's disease here in Florida relative to the rest of the country. So I believe we are second only to the state of California in the number of Alzheimer's cases. So right now we have approximately 540,000 diagnosed cases. And so I stress diagnosed because Alzheimer's disease is unfortunately one of those disorders that is horribly underdiagnosed. So we could fairly safe to assume that there's a much larger number of Alzheimer's actual number of cases here in Florida than what we actually believe there to be.
Well, there's a lot of information out there about Alzheimer's. Phil, can you separate the fact from fiction? What are the myths?
So I think one of the biggest myths is that memory is a normal part of aging. So we have a lot of older adults who come into the office, and they have this expectation that the memory problems they are experiencing are just simply supposed to happen because they're getting older. And we know that's not true. I mean, we may lose a little bit of functionality, with everything as we get older, whether it's with our mobility or how quickly we process information. So that's normal. But when those things start to impact how we live our day-to-day life, that should not be an expectation of getting older. So that's probably one of the biggest things we see. Another thing that I think pops up quite a bit is that aluminum is something that causes Alzheimer's disease. So aluminum in cans and baking pans, and aluminum is one of those things that is very, very common. And so people have this idea for some reason that aluminum is something that causes Alzheimer's disease, and we know that's not true. I think one of the other big ones that we see a lot is that only old people get Alzheimer's disease, and we really need to get this picture out of our minds of someone with Alzheimer's disease as being in their 70s, 80s, or even 90s who is completely incapacitated and unable to function. The fact is that these plaques and these tangles that formulate in our brains that actually cause Alzheimer's disease, these start forming 20, maybe even 30 years in advance of us seeing any types of symptoms. So we have to start thinking as Alzheimer's disease is something that starts to affect us in our 40s and 50s, with symptoms starting to occur maybe in our 60s. So that idea of a really older, kind of decrepit person really needs to go away at this point.
Now, are there certain risk factors that contribute to the development of Alzheimer's?
So what we're finding is the same risk factors that we've always identified for placing us at risk for heart disease are those same things that also impact our brain health as well. So we know hypertension, it's one of those things that has a significant impact on whether or not somebody develops not only Alzheimer's disease, but any number of different neurodegenerative disorders. Midlife obesity is another big risk factor. Sleeping is also a huge problem that contributes to whether or not someone develops Alzheimer's disease. There's a lot of great research that's out now that's looking at how much tau proteins and amyloid proteins accumulate in the brain just by missing a few hours of sleep after just one night. So those are a lot of the big ones. We also know that genetics is a big risk factor in family history. So there are a number of different genetic markers that are going to make people more susceptible to developing Alzheimer's disease. But we also have to recognize that just because we have these certain genetic markers does not guarantee that we are going to move on to develop Alzheimer's disease later in our life. There's a lot of other things that we can control, like our blood pressure, our weight, whether or not we have diabetes. These are all things that are well within our control, and we can moderate them in order to reduce our risk for Alzheimer's disease.
Now, are there any populations, race, sex, or anything like that that are more at risk than others?
Yeah, so we do find that Hispanics are at 1.5 times greater risk for developing Alzheimer's disease than whites. African Americans are 2 times more likely to develop the disease. And we also know that these minority populations are those that are less likely to seek out treatment. So not only are they more likely to develop it, they're less likely to participate in research and treatment. So we don't know a lot about why they have such an increased risk because we don't have the data yet to look into that, just because of a lack of participation. We're also finding that the LGBT community is also at higher risk for developing Alzheimer's disease. They also have the same type of risk factors in terms of not accessing healthcare. So we know that the LGBT community is 30% less likely to access healthcare than other people. They're also 4 times less likely to have children and 2 times more likely to live alone. So if they do go on to develop disease, they don't have the same types of support systems in place that other communities might have to help them once their disease starts to progress.
So how does Alzheimer's present if you go to the doctor? I mean, are there defined symptoms, or is it not so clear cut?
So usually, almost always, the first symptoms of Alzheimer's disease are a really mild memory impairment. So Alzheimer's is a very, very slow insidious progressive disease. So most of the time it starts off with just a mild memory impairment. So this would be things like, losing your keys, forgetting the names, not recognizing words quite as well as you used to. And a person may think initially, okay, this is just a normal part of aging. But these things continue to progress. And they get to the point to where they start to disrupt day-to-day life. A person is no longer able to multitask, right? So they can't have something on the stove and be paying attention to a conversation. So those routine tasks that we do all the time start to become more difficult. And as the disease progresses, these things start to become virtually impossible. So that's usually how Alzheimer's presents in an office setting.
Now, concerning diagnosis, can you just go to Quest or LabCorp and get a blood test, or is it more complex than that?
Yeah, unfortunately, it's not that easy right now. So typically, Alzheimer's disease was diagnosed clinically. So a person comes in and talks about the various symptoms that they're experiencing, and a clinician would determine that these symptoms were consistent with Alzheimer's disease if they didn't have any other disease that could explain why they're having those symptoms. So it's basically kind of a diagnosis through exclusion. They would also have access to MRIs just a few years ago that what we would be looking for is atrophy. So we're looking for the brain shrinking in size, and particularly in specific areas. So one being the medial temporal lobes, where you have your hippocampus, which is responsible for learning and memory. So we would send someone in and have an MRI, and if we could see shrinkage in those areas, that would give us more evidence that a person their symptoms would be consistent with Alzheimer's disease. Now we have what's known as PET scans. So PET scans were generally used in the field of oncology to identify cancers. Now, in the last few years, these have been FDA approved, and they are being used to identify the presence of amyloid and tau plaques in the brain. So those are the telltale signs, the telltale pathologies that someone has Alzheimer's disease. Unfortunately, though, amyloid PETs are not something that is covered by insurance. Either Medicare or commercial insurances do not cover them. They're still incredibly expensive. They would cost someone out of pocket somewhere in the range of $4,000 to $6,000 to have one of these PET scans done. And really, they tend to only be available through clinical research trials as a way to definitively diagnose the disease.
Yeah, and something that you talked about at the panel concerning the proper diagnosis and how imperative that is for the appropriate treatment.
Yeah, so a lot of these neurodegenerative disorders look very much a lot alike at the very beginning. So they kind of have these nondescript symptoms of problems with attention and concentration, maybe some language issues, and certainly memory impairment is something that's common across a lot of these. So we know that the treatment for one of these diseases may actually be harmful for another one. So it's very important that we get the right diagnosis. We also know that treatment is far more effective at the beginning of Alzheimer's disease, as well as a number of other different disorders. So the sooner we can start things, the more impact it's going to have on a person's day-to-day life. And the other reason, too, for an early diagnosis is that all these diseases end the same. They ultimately end in a person being incapacitated, unable to make decisions regarding their finances or medical care. And so an early diagnosis offers people the opportunity to make a lot of really important legal and medical decisions well in advance of no longer being able to make those. So they have the opportunity to have these really tough conversations with their spouses and their family members about what their wishes are once the disease progresses to the point where they can no longer make those decisions.
Well, concerning treatments, Phil, what's available and what's in the pipeline?
So currently available, there's only a handful of medications. So one class is called cholinesterase inhibitors. So these are medications that are available publicly and have been prescribed since around the late 90s or so. So the three cholinesterase inhibitors are Razidine, Aricept, and Exelon. So these drugs are designed to manipulate the neurotransmitter acetylcholine in the brain, which is associated with learning and memory. There's another class of drugs which are called glutamate modulars. There's only one medication in this particular category. It's called Namenda, and is a drug designed to manipulate the neurotransmitter glutamate in the brain. And so these are just symptomatic treatments. So they help treat, things like confusion and memory loss just for a period of time, but the disease ultimately progresses. So they do nothing in the way of slowing down the disease, and they certainly don't stop it. So what's in the pipeline now? Doctors and researchers are looking more so at what are known as disease-modifying therapies. So these are medications that are being developed that will actually disrupt the underlying pathology of Alzheimer's disease. So these are drugs that are removing the amyloid and the tau proteins in the brain after they have already been formed. There's a lot of other research now that's trying to identify what the precursors are to the development of these proteins and trying to find ways to turn off the switches that may actually contribute to the formation of these proteins well in advance of someone becoming symptomatic.
Phil, so how is the funding for Alzheimer's research? Is there enough money out there?
So we're doing pretty well with money. We could always use more. So right now, for the year 2019, the NIH has dedicated $2.3 billion to Alzheimer's research, and this is a $425 million increase over 2018. So the Alzheimer's Association has an organization called the Alzheimer's Impact Movement, and this is their funding and advocacy arm, and so they were really instrumental in getting the government to increase the funding for Alzheimer's disease. The Alzheimer's Association themselves contribute about $450 million towards Alzheimer's research annually, and we also have another private grants from entrepreneurs who are starting to step up and pledge money. So you have Bill Gates and his group who have pledged $30 million towards Alzheimer's disease. So the money's there; it's getting better. What we need more than money at this point are volunteers. So we've got a lot of clinical trials. Whether it be interventional using pharmacology or prevention trials looking at things like diet and exercise and sleep. So we need people to participate in these trials, and we need advocates. So that's where we need the most help right now, I think.
Well, I want to ask you about, I want to give you a chance, actually, to talk about the work of Axiom Clinical Research. What do you guys do?
So at Axiom Clinical Research, we primarily conduct pharmaceutical research trials for a number of different neurological disorders. One of the things that we spend the most time doing is probably working with Alzheimer's disease. So we have contracts with large pharmaceutical companies like Eli Lilly and Biogen and Novartis and Roche. And so what we do is we help them to determine whether or not the medications they're developing for Alzheimer's disease are actually safe and effective for that purpose. So we are actually helping them to identify whether or not disease-modifying compounds. So these are the drugs that are actually manipulating the underlying pathology of Alzheimer's. We have a number of trials available here that people can participate in.
Now, if somebody wants to learn more about that, learn more about the Alzheimer's Association and Axiom Clinical Research, where can they go? Social media, websites?
Oh, yes. We have a pretty good presence on social media, so you can find us on Facebook and Twitter, LinkedIn. We tend to post a lot of articles, things that are changing with regard to research. We have a lot of different community events. We also post those online. We can check out our website, which is axiomclinicalresearchoflorida.com. They can also reach us here at the office at 813-353-9613. And as far as the Alzheimer's Association, they can find them at alz.org. They also have a big social media presence, and they actually have a specific Gulf Coast chapter. So that covers the 16 counties in the Gulf Coast region, so people are able to kind of log into that particular area of the website and find resources that are available to them right in their community.
Excellent, excellent. And I'll go ahead and link to these in the show notes when I publish the podcast. And I want to thank you, Phil Sabel, for sharing your time and your expertise. I appreciate it.
Thanks for having me.